I'm Shevie Kassai, a general and trauma surgeon. Here at Centennial Hospital, we offer the care that you need, and we offer it right here in your community close to home. One of the most common surgeries that we do perform is laparoscopic cholecystectomy or gallbladder removal. So the gallbladder doesn't actually make bile, which is something that helps your body digest food. It is a storage reservoir for bile. So your liver makes the bile, produces it, and it sends it to the gallbladder to help store it between meals. And then after you eat a meal, that bile is released and helps you digest food. Gallbladder disease, the gallbladder forms stones, and so those stones can sort of get stuck in the gallbladder and cause obstructions. And if there is an obstruction of one of those stones, that can cause a lot of pain and can cause the gallbladder to get inflamed or cause something called cholecystitis, which is an inflammation of the gallbladder. Sometimes there aren't any stones in the gallbladder. The gallbladder just doesn't squeeze right. It just is not functioning well. Instead of presenting as sort of an inflammation, will sometimes just present as pain. In general, we see this more in female patients in their 30s or 40s, sometimes women who are slightly overweight, women who are childbearing age. That's a very common patient population to see this with. But it's seen in people of all ages. So the gallbladder is nestled right below the liver, sort of right over here. So a lot of times if someone has gallbladder disease, what they'll feel is after eating food about a half hour after a meal, cramping abdominal pain right here in the right upper quadrant below their liver. So it'll be sort of a colicky, come and go abdominal pain. We are able to cure gallbladder disease by removing the gallbladder. And so the question people often ask is, if we remove the gallbladder, then what happens to all that bile? Because if your gallbladder is not storing the bile anymore, how is your body going to be able to digest food? But the gallbladder is really only the storage reservoir for the bile. The liver can get the bile to the intestinal tract without the gallbladder. And so if your gallbladder is not functioning right anyways and not squeezing at the right times, you probably are someone who would be better off just having the liver sort of communicate with the intestine directly. At this new state-of-the-art hospital, we really offer the gamut of whatever you need. We're able to be here close to home in your own community, and we're honored to be part of the team to help offer that to patients.